All right, so we're going to talk about the hematopoietic system. So let's talk about some of the functions of blood as they appear in your packet. So one of the functions of blood is that it carries clotting factors in it. So then the blood can clot. Also, it's important for temperature control. So if your extremities don't have good blood flow, then they'll be cooler because blood is a source of heat. Blood pressure maintenance, it's important to maintain blood pressure, and that gets into shock and all sorts of things like that we'll talk about later in the semester. Also important for pH buffering, which I think we've already talked a little bit about, and we'll talk more about that. pH is super important, and it transports different nutrients, oxygen, glucose, hormones, and electrolytes for the body to use, for the cells in the body to use. Okay, so let's talk about some of the components of blood. We have plasma, the buffy coat, and erythrocytes. So erythrocytes makes up about 45% of the blood, and that is the hematocrit. And then platelets and leukocytes, those white blood cells, are going to be in the buffy coat. And then plasma holds water, proteins, and albumin is going to be that main protein that we're looking at. Electrolytes, gases. It also holds some clotting factors like fibrinogen and the Roman numerical clotting factors. Um, and serum is plasma without the clotting factors. So if the healthcare professionals need to study your plasma, but they don't need to study clotting, then they'll use your serum. And then triglycerides and cholesterol are also in the plasma. Okay, so red blood cells. Um, EPO or erythropoietin is secreted by the kidney in response to cellular hypoxia. So the cells aren't getting enough oxygen, uh, and the kidney tells the bones to make red blood cells so that there will be more oxygen. So erythroblasts become reticulocytes, and reticulocytes become red blood cells. So if you see reticulocytes um, in the blood, then you know that the bone marrow is working because it's creating those red blood cells. Um, they're a shape of a biconcave disc, and one of the reasons for this is it creates more surface area for oxygen to attach. They live for about 120 days. So that's one of the reasons why A1C tests for blood glucose tell you how much blood has or glucose has accumulated in your red blood cells over the last 3 months. Is that because that's how long um, red blood cells live approximately? And then reversible deformability means that they can kind of squeeze and squish to get through those thinner blood vessels. Some other things to know, carboxyhemoglobin is when carbon dioxide has attached to the hemoglobin in your red blood cells, and it has a huge affinity for the hemoglobin, so 250 times that of oxygen, and it can trick a pulse oximeter. So pulse ox uses that light, right, to see the oxygen attached to the hemoglobin, and it may read a high oxygen reading even though it's carbon dioxide. So they use pressurized chambers to kick that carbon dioxide off the red blood cells. Fetal hemoglobin has more affinity for oxygen and it becomes adult hemoglobin at 6 months of age. And 80% of the body's iron is in hemoglobin, so it's recycled. So when the red blood cells are destroyed, the body uses that iron from the hemoglobin to um, for its own purposes, usually to make new red blood cells. Okay, so talking about thrombocytes, the normal range is 150,000 to 450,000 platelets per millimeter cubed. And then 1/3 of all your platelets are in your spleen, and that fills up 40% of the spleen. So they're kind of stored there. And thrombocytopenia can be because of impaired production, pooling in the spleen, or destruction. So talking a little bit more about that, different things that can cause this are drug-induced thrombocytopenia. So aspirin, torvastatin, um, some drugs attack the bone marrow, and so it will produce um, less platelets. And then heparin induced. This confused me because I thought like heparin was a quote unquote blood thinner, but it's supposed to inhibit thrombin, not platelets. So this is an entirely different problem. It's very severe and it causes the activation and destruction of platelets, and that can cause a thrombosis, which can be life-threatening. Immune idiopathic thrombocytopenic purpura is destruction of platelets by the immune system and results in bleeding gums, petechiae, which is those red spots on the skin, and internal bleeding. So look for that purple bruising and bleeding gums if you're worried about that. Okay, so these are six things that are essential for healthy red blood cells. So if we're thinking about this, healthy kidneys, erythropoietin is produced by the kidneys, so you're going to need that erythropoietin in order for blood cells to be produced. Healthy thyroid gland that also stimulates, well, that stimulates red blood cell maturation. So kidneys stimulate the production, thyroid gland stimulates the maturation. Iron is essential for heme, as we've already talked about, and then vitamin B12, vitamin B9. Um, those can cause different kinds of anemias if you're not taking enough of it. Um, and then healthy immune system, so you're not destroying your red blood cells. Okay, so this confused me when I took the class, and so I have a little analogy. Hope that this doesn't just make you more confused. If it does, then ignore it entirely. So there's three different indices for red blood cells. Mean corpuscular volume is the size of the red blood cell. And mean corpuscular hemoglobin is the average weight of the hemoglobin in that red blood cell. And then mean corpuscular hemoglobin concentration is the average concentration of hemoglobin. So what are the differences between these two? I'm going to compare them to a basketball. So whether the basketball is large or small, mean corpuscular hemoglobin or MCH can be compared to the amount of air in the ball. So that hemoglobin is like the air. So the ball can have this same amount of air, whether it is small or large, which that leads us to MCHC, which is the concentration of the hemoglobin. So if we have a really small ball, so that's small MCV, with a normal amount of air, that's MCH, um, then the concentration would be high, right? Because it's a small ball, normal amount of air, that'll have high MCHC. So if we have a small ball with a normal amount of air, that'd be small MCV, normal MCH, and a high MCHC. Um, but MCV and MCH typically trend together because smaller cells typically have less hemoglobin, and larger cells usually have more hemoglobin, making MCHC or the concentration more stable. So a little practice. We have iron deficiency anemia versus megaloblastic. So in iron deficiency anemia, you're going to have a smaller cell with less hemoglobin, and the hemoglobin concentration is decreased. So if you want to practice, you can pause the video and decide what the MCV, MCH, and MCHC would be. So for that one, it's going to be low MCV, low MCH, and a low MCHC. So all of them will be low for iron deficiency anemia. So for megaloblastic, you're going to have an increase in size, but no increase in the ability to make hemoglobin. So you have the same concentration of hemoglobin. So for this, you're going to have a high MCV because the size has been increased, and you're going to have a high MCH because you're going to have a normal amount of hemoglobin for that cell, but you're going to have a normal MCHC because um, it's going to be the same concentration of hemoglobin. Okay, I hope that makes sense. Reach out to me if you have questions. Okay, so let's talk a little bit more about iron deficiency anemia, some of the symptoms. So you're going to have pale skin, brittle hair, and nails. So one of the reasons for this is that there's ferritin. Remember, Fe on the periodic table is iron, right? So ferritin is practically iron, and that's used to make heme. So when your red blood cells don't have enough iron, then they're going to take that iron from your hair, They're going to take it from your tissues, so that's why you get, I think it's pronounced cheilitis. And your nails will get those red those streaks in them. So it's taking that iron where it can, so that um, it can make that heme. And then also, too much cow's milk can prevent absorption of iron. Um, and then women can have iron deficiency anemia due to a loss of blood during menses. So I just want to encourage you to go into the packet and uh, look at the definitions for IDA in women and what qualifies as menorrhagia or excessive bleeding. Um, and then, so heme, iron is found in meat, and then non-heme can be found in other foods, but it needs acid or vitamin C in order for it to become heme iron to be used by the body. And absorption is decreased by calcium. So remember milk, that cow's milk, and then tannins, which are tea and coffee, decrease absorption of iron. Okay, so let's talk about a few different anemias. Um, Pernicious anemia is a lack of B12. So intrinsic factor is a factor in the stomach which helps us to absorb B12. So if you have low intrinsic factor, you're not going to be able to absorb B12 as well, and you're going to be at a higher risk for pernicious anemia. It has neurological effects because B12 helps to synthesize the myelin, which is the coating, and you're going to have an inflamed, beefy red tongue, as you can see here. Okay, folate deficiency anemia. Um, Folate does not need intrinsic factor, but we need to take it in. We need to eat it. Um, so external source. And so people who don't eat enough, such as alcoholics, because they're getting a lot of calories from alcohol, or people who need more of it, like pregnant people, because they need folate for two, right? And their baby is developing and needs that folate, they need to increase their intake. And it can cause neural tube defects in babies. So if you are um, trying to have a baby, then you should be taking folate supplements. And there are no neurological defects like pernicious anemia. And then another name for folate deficiency anemia is megaloblastic anemia, which we talked about a little bit earlier. I don't think you need to know that, but okay, aplastic anemia. So this is damage to the bone marrow, resulting in low everything that's in the blood because bone marrow produces everything. So that includes white blood cells, red blood cells, platelets. Um, so some causes, it can be a result of toxins, infections, drugs, and it can also be idiopathic, which is an autoimmune process. And it will result in hypoxemia because you don't have enough red blood cells to carry that oxygen, infection because you don't have enough white blood cells to fight the infection, and hemorrhage because you don't have enough platelets. So, a big problem. Sickle cell anemia, this is more common in those of African descent. Um, I don't remember if Dr. Beckstrand talks about it in this class, but some think that it could be a protection against, I think it was malaria. Um, because anyways, this is interesting thing with genetics and any, anyways, well, you don't have to remember that, but I just thought it was interesting how this could survive because it helps people survive malaria. So more, like I said, more typical in people of African descent. Um, Sickling can be triggered by a bunch of things. The packet mentions hypoxia, dehydration. I don't think it mentions many others, but high altitude, stress, things like that can cause sickling. And it's super painful and it causes this clotting. So you can see they got kind of all clumped together and so they can't get into the blood vessels. And one of the treatments for this is hydroxyurea, which is a drug. And of course, hydrating, um, treating the pain. Sometimes they do blood transfusions. Okay. Hemophilia A. So this is more common in men because it is an X-linked. So that means that women carry it, but women have two X chromosomes. So the other X um, can't hides the manifestation of hemophilia A, but men only have one X. So if they have it, then they're going to manifest it. Um, this is when you have low factor VIII, which is one of those clotting factors, the Roman numerical ones that I mentioned earlier. So if you don't have this or you have a low amount of it, then you're going to be at a higher risk for clotting. Um, and then you're going to have bleeding and hemarthrosis, which is bleeding into the joint. Sounds very painful. And the patients also bleed in the feces and from other areas. And treatment for this is to replace factor VIII. And like if kids have this, then they learn how to like do their own IV injection of factor VIII. That's pretty cool. Okay. Von Willebrand disease. There isn't too much about this that you have to know from the packet. Just that it's common. It's very mild. Pretty much the advice is just to avoid aspirin, because aspirin can increase bleeding if you have this. Okay. Disseminated intravascular coagulation. So this process can be triggered by many different things. Sepsis is the most common cause. Injury can also cause it. And what happens is all of your platelets start clotting and they create all these little microclots. And then you've used up all your platelets. And so then you bleed. So you have all these microclots going through your bloodstream and you're also bleeding. So not good. All right. Hope that was helpful.